Thank you so much, Dr. Edin. That was a lot to digest. So I want to go ahead. I have a couple of questions. I'll start with a couple of questions, and then I invite the committee members to, as well as the audience after the committee members go. So my first question is really thinking about, if I can help, if you can help us as the committee, think about how can policies be either developed or thought about, particularly with the fathering. And I imagine Natasha Cabrera is probably happy with the focus on fathers and fathering. So how can policies be sort of enacted to think about the fathering perspective and the mothering perspective, as well as sort of, you talk about the deep poverty. So here we're talking about trying to understand how to support parents. How do we consider this issue of sort of extreme poverty in light of that?
Great questions. So I'll start with fathers. When we talk about parenting, we talk about mothers and children. I was really happy to see in the last presentation some evidence that a strong mom and a strong dad can make a difference for kids. But I suggest that that language is a problem, and we really need to sort of develop really a whole new script about parenting, one that is inclusive of men. I think we also need to divest our cultural institutions, our social institutions, of the idea that it is the mother that is parenting the child and not the father. So I've suggested in written work that we revamp American institutions from the clinic where you go to get your ultrasound all the way through the parent contact form at school, all the way to the parent-teacher conference. We need to signal to men that they're important, that we value them. We need to value and enforce their parenting time. We need to adjudicate parenting time, as Michigan and Texas do when we issued them a child support order. Deep poverty. This is a group of people that is poorly served by the safety net. Only 10% of households get even a penny from TANF over the course of a calendar year who fall into at least 3 months of the situation. Only 50% are getting SNAP. Interestingly, almost every household is getting some form of government health insurance. So there are ways to reach these folks, right, through our healthcare centers. What we probably need is a radical rethinking of work opportunity in this country. PRORA did pretty well at instilling personal responsibility. Single mothers went to work, and they have not come back on TANF. But we haven't done is we haven't fulfilled the work opportunity part. And that's going to be hard to do, because I think there's growing evidence that there's simply not enough jobs to go around, and the jobs we have are becoming badly degraded at the bottom, so they are less and less family friendly. Third, we do need to resuscitate TANF, because work will never always be the solution. There will always be some people who can't work but are not badly off enough to be considered disabled, and disability forces you to choose, right? Whereas TANF could be a more subtle mechanism. So we need to rethink the perverse incentives that we're providing states to keep more and more people off the rolls while funding other state budgetary items.
Okay. So,
Vishwanath, Kathy, that was very nicely done. So you have been talking about this notion of, you changed it, serial parenting to serial fatherhood. Last time we talked about serial parenting. So now I'm trying to think of what is the best way to change the public discourse around this issue, right? And from a public communication perspective. So could you give us a couple of arguments that, I mean, one way to, well, so what? Yeah, I mean, there are big changes, but are there a couple of big arguments that we can use in terms of implications on the impact of children or on society that we can use to change the public discourse around this issue? Because that has implications of the policy discourse.
Yeah, so I think this offers us a rhetorical advantage. My students at the School of Public Health really don't like the marriage and family structure section of my course, at least at the beginning. Because when you talk about unmarried versus married parents, you're adopting something they see as sort of moral and moralistic and patriarchal. When instead, I have this series of stick figures I often show, showing how complex, what a complex and unstable family looks like. And when they sort of look at this highly complex, highly unstable family form, from the point of view of the child, they're quickly convinced that we should be worried about this, and it's easier to sort of think about the evidence. So what we're seeing is that when you look under the cover of the term single mother, you know, it's a completely misleading term. What you're really seeing are these highly complex, highly unstable family forms. And when we think about how to intervene, right, so we think about a single mother as needing support. But instead, if what's going on is just churning between partnerships with children along the way, we might envision a very different intervention, one that really helps mom and dad think about the impact of that churning on the life of a child. You know, we're now interviewing, following cohort of dads through the PACT study. I'm working with Mathematica to conduct a study of fatherhood programs across the United States. And what we're really trying to do is capture how men are coping with these highly unstable, highly complex family forms. And it is overwhelming. It is hard to imagine that even one of the most competent people I know, Greg Duncan, could father effectively in this kind of situation. And from the mother's point of view too, she's trying to parent across multiple partners, making her job extraordinarily difficult. So I think if we understand what the real counterfactual to the married two-parent family is, we can be much more effective in our interventions.
Okay, thank you. Natasha?
Thank you. Good morning, everybody. Natasha Cabrera from the University of Maryland. Hi, Kathy. Nice to see you, and thank you so much. I really enjoyed your presentation. I have a couple of comments, questions, and maybe to share a quick story. I really love the fact that you emphasize fathers are parents, too. I've been trying to say this for a long time, and the broken record in me will continue to do so. I've been doing, as you may know, some of the work with fathers, trying to understand when they're present in that home, not just when they're absent and missing, what is it, how do they bring about child development changes that are good for kids. So I really like that. I just wanted to bring, to kind of raise the heterogeneity issue that you talked about earlier, and to bring about some conversation about the ethnic or cultural context of fathering. The stories that I see are a little different from the ones that you presented. And the poverty looks a little different from Latino men that I've been interviewing and including to my studies in the last 5 years. So the Hispanic Center released a household demographic brief, and it showed clearly that multi-partner fertility is really uncommon in Latinos, right? They're more likely to stay together. They are working 3 jobs, 4 jobs, so the time with the parents is limited, but they kind of live there. And the families that I see, the fathers are there, they're present, the gatekeeping is actually the other way around. So in many ways, family formation, partnering, looks a little different in a Latino household. And I wonder, as we go forward and think about what does fathering and parenting mean, to kind of understand that context a little more. When I look actually within the Latino group and I look at immigration patterns versus the story is even furthermore different. Right. So the Latino born here may look a little more like the dads that you're describing, and the immigrant dads are much more different. They have all those issues, but in much lower proportions. And I think the issues of poverty might be different. And I'll end, and I'll love your comments, and I'll end with a story. 22-year-old Carlos, who came from Nicaragua in my study, he came here 5 years ago. He's parenting a child with his partner. They're both unwed. He dropped out of school in 2nd grade in El Salvador or Nicaragua, I forget now which country he came from. So he's illiterate in Spanish. He obviously does not speak English very well. And when he takes his child to school, he's co-parenting actually with his partner. The school tells him, you should read to your child all the time. Now, he doesn't read very well in either language, so literacy issues. He loves his child. He's involved. In fact, the couples are no longer together, but they decided to take one day off to co-parent. So they sit around, they talk, and they say, okay, what are we going to do with this child? They are being parenting the child together, but the poverty conscious is much different compared to another person, another native-born Latino man in my study who's born here. He went to high school, and so he has more, his reference point is different, or reference idea of what.
Natasha, can you just, because other people are going to ask
Okay,
questions.
sorry. So the question is, how much the ethnic and racial context of your study, would it be helpful for us to think about that poverty might look different, and then for fathering might look different in these two groups? Thank you, sorry.
Yeah, so I think all of that is true. We do see a different meaning of cohabitation, especially maybe among Mexican Americans than among native-born or African Americans. So I'm not going to contest any of that. I will say that all of the quantitative work we've done and the work with the Fragile Families qualitative subset has included Mexican American and Latino men. So I have to look back at our demography paper to see if we saw a difference with Latinos, but I'll do that and get back to you.
Okay. Who was next? Okay, good.
Vivian Gadsden, chair of the committee from the University of Pennsylvania. Kathy, first, thank you. It's all that I expected and more, so thanks again. So my question is it's going to be simply worded, but I don't know that the field has an answer. So in many of the programs, parenting programs serving young children, there is this inherent tension around how the staff will work around issues when parents are not together, but both parents want to have some involvement with the child in the parenting program or in the child care centers. What are your insights or kind of understandings of how the fathers with whom you have worked have tried to negotiate that, and what are the possibilities that we might consider in helping folks who are going to be doing parenting programs where they are going to take seriously father involvement, but how are they going to address those issues in some meaningful way? And I know there's not a realm of empirical data on this, so it's a kind of sense that might inform us in some way.
I spent a lot of time since Doing the Best I Can came out. Tim and I have been spending a lot of time talking to Head Start teachers and visiting nurses. And the visiting nurses are really interesting. What we've done with them is to really try to present what the real counterfactual is. If dad doesn't stay involved with his child, what are the real consequences? It's not a stable single mother. It's the shifting pattern of family allegiances. I think that's been very effective for this group. And after I talk, oftentimes people come up and say, man, I just told a client last week to just wash that man right out of her hair. And I'm going to go back and tell her, I've rethought that idea. It's in some ways, our nation's visiting nurses and social workers, who are wonderful, well-meaning people, can inadvertently act as gatekeepers, or just like the moms are, and they can reinforce the message that dad is peripheral rather than central. But I've seen tremendous responsiveness to this message among visiting nurses. I visited them all over the country. And just an eagerness to think about how to involve dads. And they're really the front line into these families. So yeah, I know states are experimenting with ways to include dads. The amount of work a visiting nurse has to do her job is kind of overwhelming, so we might need to sort of rethink how we package these treatments. I want to say one other thing, though, that relates to the last session, and that is there was talk about teaching men child development information and skills in high school classrooms. Fatherhood programs around the country are doing just this. They're teaching basic child development to dads, and dads love it. And so our interviews are full of rich accounts of how they're learning, that you have to have different expectations for kids of different ages, and all of the things that were talked about in the last session are things that men are really seizing on. They not only want to be parents, they want to be better parents, and in particular, they want to be better parents than their own fathers.
Thank you. Rich?
Thanks, Rick Barth from the committee. Kathy, I know some of your analyses on these families in deep poverty that weren't using SNAP and weren't using TANF come from survey data rather than your interviews, but whatever the source, I'm wondering if you have a sense of what some of the fundamental reasons are. We know some policies, like you can't use SNAP in some states if you had a felonious drug arrest, are barriers. Are the barriers policy barriers? Are they logistics like transportation? Are they behavioral health? I'm sure they're a little bit all of above, but if you could give us some ideas about levers to try to help increase the use rate for needy families, that would be very helpful.
Prior to welfare reform, about 75% of households with poor households with kids got something from AFDC. Currently, I think LaDonna Pavetta's latest estimates are about somewhere between 25 and 28% of poor kids get anything from TANF in a given year, so that's a huge drop. Nobody knows why the drop occurred. Some due to administrative barriers. I think the state of Georgia is the most egregious state in that regard, where social service agencies aren't even telling clients to bother to go and apply for TANF. Other states are doing similar things. There's some evidence that caseworkers are actually discouraging clients from applying for benefits they're actually eligible for. But more than that, our experience in the field, and I've been talking about this issue with single mothers, since the early 1990s, is that welfare is just not on the minds of the poor anymore. It has been delegitimated to the point where when you hit a hard time, it just doesn't occur to you to go to the program. So one extreme poor mom we've been following in Chicago asked her why she wasn't on TANF. She said, well, didn't you hear they're not giving that out anymore? I talked another mom in Cleveland into actually going to the welfare office and applying because her straits were so desperate. And they told her, according to her, oh, honey, we just don't have enough to go around. And this was despite the fact that the state was sitting on a surplus. But many other mothers say, I'm not going to do that. I think of myself as a worker and not a dependent. I would never go on welfare. So there's evidence, at least anecdotally, that the stigma has risen a lot. And when you look at the data on the extreme poor from the SIP, what you see is that 70% of those households had a household member, an adult, who worked during the past year. So these are people who are really getting battered around by the low end of the economy. But in large part, they see themselves as workers. And they want to work, and they're kind of hanging around at the fringes of the low-wage labor market, trying to reconnect. TANF seems to be sort of an identity shift that they're not willing to make.
Thank you.
Thank you. So without any more questions from the committee, I think we have a question from the public. Please.
Thank you. My name's Andreina Velasco. I'm here from Portland, Oregon. I work with families in a low-income neighborhood in southeast Portland, preschool to 5th grade. And as I was hearing your talk, I was thinking specifically about my friend and colleague Lucia, who is a young mother. She has 5 kids, 3 years old to 9, and is on TANF. In Oregon, there's a program where you have to apply for work if you're on TANF or actively look for work, or also intern. And Lucia was bright. She came to the school and said, can I intern here? Because I want to be close to my kids, and I need skills, and I'm interested in children. And throughout the year, we've seen Lucia's skills develop. She's become a parent leader. She coordinates our smart reading program, and she's actually now been hired part-time by the school. So my question is, how can you educate me about policy connections and partnerships that schools, early childhood centers can do, collaborate, innovate with people who have access cash assistance or have access SNAP and can actually overlap with the key knowledge and skills and practices around child development?
So we have tried over and over again to make our cash welfare program an employment program. We started with Jimmy Carter, Ronald Reagan tried, George Bush tried. In every case, TANF proved unable to do the job. I should say that California is the only state in the union with a really fully functioning TANF system right now, and the proportion of poor families on TANF in California is not substantially different from the period before welfare reform. There's so many. This is such in contrast to the rest of the nation that 37% of all TANF children live in California. So this is, you can do this right, right?
Yeah.
It is possible to do this right. You know, I love that model, and that is what TANF ought to be. It ought to be a hand up and a connection point to work. But I think in most states, at least, TANF has become so degraded in the minds of the poor that we need a different model.
Okay.
If you look at the levels of stigma in various programs, and I sort of discovered this in some work I did with the USDA a couple of years ago, where we interviewed 90 households across 6 states. It seems that the SNAP, you know, even the SNAP program is sort of degraded in the minds of the poor. It's seen as stigmatizing. But WIC is not. Everyone loves WIC. And part of the reason they love WIC is because they see it as educational. So we don't do education in our SNAP offices, and parents were indignant about this, but they loved the fact that they learned nutritional information at the WIC office. So I think we need to think strategically about where to house our interventions, and SNAP and Head Start are both sort of institutions that people associate with you know, universalness, and where they don't feel stigmatized and shamed as a part of coming to the program.
Could schools be part of that equation as well?
Yeah, you know, Mario Small has done really nice work in his award-winning book, Organizational Gains, about how Head Starts provide a key informational resource to parents. And one of the only key institutional arrangements in which parents can exchange information and assess mutual help because of you know, the degradation of our institutional cultures, especially in low-income neighborhoods.
Okay, so we have to end it now, so thank you. I'm sorry we couldn't get your question. So thank you.